Hey everybody, welcome. Tana and I are so excited to welcome one of our own physicians, Dr. Shane Creado, who is a board-certified psychiatrist, but also a sleep medicine specialist. He just completed his psychiatric residency and sleep medicine fellowship at the University of Wisconsin, where he was awarded the Graduating Resident Award for Academic Achievement. He's also a sports psychologist on the board of directors of the International Society for Sports Psychiatry. As its chairman of memberships. I love that because sleep is so important to peak performance, whether you're a mom, whether you're a CEO, or whether you're a professional athlete. I have a funny story we'll talk about. He also has experience with veterans, college mental health, with mindfulness, something called CBT or cognitive behavior therapy specifically for insomnia. He's just very special. He's in our Chicago clinic and in the fall going to move to our New York clinic. So Shane, welcome so much.
Yes, welcome. This seems to be a topic really important, especially with a lot of women my age. So I think this is really good we're addressing this.
So why do people need to sleep, and why are you interested in it?
Well, thank you so much for this warm welcome, both of you, and I'm glad to be on today. Sleep is one of the most important things we know for brain health overall. We are supposed to spend 1/3 of our lives sleeping, and not many of us actually end up doing that. In fact, over 35% of the population gets less than their ideal sleep. And across the board, we're seeing loss of revenue, dips in performance, lost work performance, athletes being impaired. And so the major disasters of the world can be tracked back to sleep deprivation, from the Exxon-Valdez oil spill to the Challenger disaster, to the 3 Mile Island disaster, to Chernobyl, actually. So it's one of the most important things we need to get a handle on. And just as we take care of brain health, we want to look at our regular checkups in terms of colon cancer and screening for those things. I think it's crucial we really dig in deep and figure out how to optimize our sleep. Not just quantity, but also the quality of the sleep we're getting.
So what are we doing in our society that's messing us up?
There's a lot of things we're doing wrong. We have our screens and our smartphones to begin with.
Right.
We have this situation where we think it's okay to sit and read in bed and watch TV in bed. Screens are everywhere. They're in the bathrooms. They're everywhere we go. We're drinking alcohol in the evening, which can disrupt our sleep in the middle of the night. Our whole society is based on work performance and meeting deadlines, and everything is broken down to a checklist. What happens is we're just going from one stressful moment to the other. And in the end, our sleep is suffering. Because in modern sleep medicine, we don't look at insomnia as a lack of sleep, but a preponderance of wakefulness of the brain. If your brain is in danger mode, you're not going to be able to rest and get quality sleep.
That's so interesting. I heard in 1900, Americans on average got about 9 hours of sleep at night. And now it's more like 6 hours and 45 minutes. And so can you imagine in such a short period of our life here on Earth, just 100 and some years, to have that kind of radical shift is got to go with some pretty serious cognitive and mental health problems. So if people are not getting good sleep, what are the consequences of that?
There are lots of consequences. I mean, poor sleep can make you fat. It's strongly linked to weight gain.
Right.
When we look at this hormone leptin, if you're sleep deprived 4 hours, your body thinks that you need 900 more calories, so you're going to feel hungrier. You're going to eat more. You're going to gain more weight. It's going to worsen your risk of sleep apnea. That can also worsen your quality of sleep. So that's a fact. Weight gain is associated with lack of sleep. Now, good sleepers tend to eat fewer calories because they don't feel the calorie deficit. With less sleep, you're going to end up in a situation with more inflammation. Across the board, there's worse inflammation. A growth hormone won't be released the way it's supposed to. This is especially important in kids. It can affect their growth. Good sleep can improve concentration and productivity. You're going to feel more alert. You're not going to be chasing the day if you sleep well. The consequences of not getting good sleep are that you're not going to be able to focus, your concentration, and they've done this in many studies, your hit reaction times, your ability, in fact, to even perceive the fact that you're not performing well is going to be impaired.
Right.
In the study that we saw, it shows that people are not even aware of the fact of how sleepy they are. It's going to result in workplace accidents. Sleep apnea alone, which is one of the causes of poor quality sleep, is going to cost our country every year over $150 billion.
Wow.
We're going to talk about sleep apnea in the next. We're going to talk about sleep apnea in the next podcast.
Okay.
This is just so important. And so, you always hear me talk about brain envy, that you have to care about your brain. But I've learned you also have to have sleep envy.
Yes.
That you need to get serious about this, because if you don't sleep, as you said, you can be overweight and unhappy.
Yeah, and in our house, sleep. This is something I seemed to have been able to get away with it a little easier when I was younger. I was a trauma nurse, and there were times we worked 24-hour shifts. We worked double shifts. Usually ended up being about 20 to 22 hours, but that's a lot of time on a trauma unit.
They really had you work
20
double
hours.
12-hour shifts?
Yes. Usually it turned out to be 20 hours minimum. So
that's when mistakes happen.
And the funny thing is,
Exactly.
on a trauma unit, you're taking in a lot of drunk driving cases and people who fell asleep at the wheel. Okay, who were not drunk but fell asleep at the wheel. And then we turn around and we do the exact same thing. And we had residents at that time who were working ungodly hours in the hospital. It was before the 80-hour law.
Shane remembers this. Even 80 hours a week is a lot.
No, and this was before that law was passed. So,
well, I remember that's when I was a resident.
Yeah, they would literally pass out on the floor.
I'd be up 36 straight hours.
Right.
And I knew I was going to kill someone.
And I
just knew I was going to kill someone because I couldn't think.
Right, we saw this happen and we would turn around and do it to ourselves. Anyways, I used to be able to get away with it more, I thought, even though I hated it. But now, everyone in my family knows, I know I can't get away with it. If I am 1 hour short on my normal sleep, I am miserable. I feel miserable the next day. I feel like I'm walking through mud.
Did you say
I can't
you're miserable
focus.
to me?
I am miserable to everybody, and you get less love. He knows. Do not wake me up. There's no love happening if you wake me up. Do not wake me up. So it's not happening. Because I don't feel good. I feel wonky, just weird. So for me, it's 8 to 8.5 hours, and I don't feel right if I'm not getting that.
All right. So we have sleep envy, things to avoid. So screens, alcohol, which is odd because, alcohol puts people to sleep, but then it then wakes you up as your brain rebounds.
Exactly. It's going to make your brain more alert in the middle of the night when you need the sleep the most. Avoid nicotine, avoid caffeine close to bedtime, of course. If there are medications that you're on, those can worsen your sleep. People say, I'm on this antidepressant, it's going to help me sleep better, but it can worsen restless leg syndrome, and therefore you're going to be up more. So,
well, and you and I just talked to someone who started an SSRI, and all of a sudden his jerking, his movement disorder started, and that's not the first time I've heard that. So, it doesn't mean you should throw away your antidepressant. You should talk to your doctor. But there are natural ways to boost your mood that you absolutely want to be engaging in those things. Like if you had diabetes or heart disease, please don't stop your medicine. But please put the lifestyle stuff into your life because you might be able to get off of it or need less of it.
Well, and there's the one thing we can't forget about also is when you have a partner who either has sleep apnea or I always say you slay dragons. When you travel, when Daniel travels, he doesn't have issues with all the other things. But for some reason, when he travels and he comes home, I notice I say he slays dragons in his sleep, for whatever reason, he gets really restless. And that will keep me awake. I mean, so I hate doing it, but we've set it up to where I know if he's got this little like slaying dragon thing going on, that night I'll go sleep in the spare room because I'm just not a nice person the next day if I don't sleep. So, but it can affect your partner.
Absolutely. And in fact, when people come to me because they cannot sleep, I always want to know what the bed environment is like, whether their partners are snoring or thrashing around, which is causing them to have a disrupted sleep. I'm not going to give somebody a medication if we can find the underlying cause of the sleep issue. And if it's their partner, for example, if the partner is snoring, tell the partner to sleep in another room or use earplugs, for example.
That's what I do, yeah. I use earplugs.
Yes, and 12 pillows. I'm not sure what the pillow thing is about. We should spend some time with that. Energy drinks. They're so common. I'm just listening to Tony Hsieh's book, Delivering Happiness. And for some reason, he fell in love with Red Bull. And it's really irritating me because he felt like he could, go on and on and on. And what do you think about energy drinks?
I think they're best avoided. I mean, irrespective of whether it's near bedtime or far from bedtime, they have caffeine, they have taurine, they have all these other things that you add to the mix. And then you're going through a cycle where your brain is up and down with these in and out of your system. It's just I would avoid it. I avoid energy drinks personally. When I was on those 20-hour, 26-hour shifts in the hospital, I didn't touch caffeine. I take frequent naps in between when I could.
Well, it becomes a vicious circle. It becomes a vicious circle because people do the caffeine to stay awake, then they don't sleep, and then they have to have the caffeine the next day, and it becomes this like terrible vicious circle.
So, but if you have problems, so say you begin to get your lifestyle right, that you're avoiding caffeine during the day, you're not drinking at night, you at least put blue light blockers on your phone, that your room is dark and a little bit cooler and quiet. So those are some of the lifestyle stuff. And people are still struggling. What are the things you recommend to help people get better sleep?
Okay. Now that leads into what the underlying cause of their disrupted sleep is, right? So if they're taking care of the behaviors and all the substances they're consuming, then we look at sleep disorders that might be impacting them, whether it's sleep apnea, restless legs, narcolepsy, which causes fragmented sleep. We look at psychiatric disorders like depression, PTSD, anxiety. We look at sleep disorders like delayed circadian rhythm. So, for example, if I'm the kind of person who's a night owl who can't fall asleep before 3 a.m. and I need to wake up at 12 p.m., that's my natural rhythm. How do I shift the rhythm properly using melatonin and light? Medications. I want to go through my entire patient's medical list to make sure that no medications are causing problems with their sleep. And once we've dealt with all those underlying factors, medications, drugs, health issues, psychiatric issues, then we talk about targeted approaches, natural approaches first. The gold standard for disrupted sleep or insomnia is cognitive behavioral therapy for insomnia. It involves specific behaviors and strategies to optimize your sleep. Things like having a fixed wake-up time, not staying in bed too long. If you're only getting 5 hours of sleep, but you're lying in bed for 9 hours, you're actually helping your brain think that it's okay to stay awake in the bed and think. It's like Pavlov's dog, the experiment with the salivation and the bell. That's exactly what people are doing with their brains. So I say, if you can't fall asleep for more than 20 minutes, get out of bed, go to a comfortable chair, read a book, not a screen, but a book, then go back to the bed. Have a consistent schedule, whether it's a weekday or a weekend day. Irrespective, your sleep schedule has to be fixed. Avoid naps during the day. Avoid any stimuli like bright lights, screens that will affect your ability to fall asleep. So there are behavioral strategies. How do we figure out if someone is worrying all the time? Busy day, go home, get to bed, that's when their worry time is. No, let's schedule a worry time earlier in the day. so that when you're hitting the bed is just for sleep and sex, for nothing else. No reading in bed with your partner. You can read together on the couch if you'd like. No watching TV in bed. None of that. So being very strict with yourself. And patients think I'm crazy when I say, I know you're feeling sleepy, but you're not going to nap at all during the day. And if you're only getting 5 hours of sleep every night, we'll only have you in bed for 5.5 or 6 hours of sleep. 6 hours of sleep. They say, no, I'm going to not function the next day. But it's really important to be strict with your brain. Of course, when we restrict the time in bed, the two conditions I would say that's a bad idea is bipolar disorder and seizure disorder, because sleep deprivation can trigger episodes in those conditions. Otherwise, by not allowing yourself to nap during the day and by consolidating your sleep at night, by reducing your time in bed, you're actually forcing your brain to get into rhythm once again. So those are some strategies called under the umbrella of cognitive behavioral therapy for insomnia, which I do, and we will be having a video series on that as well.
Oh, that's fantastic.
What about, so one of my favorite techniques is we make a hypnosis audio that's on BrainFit Life for sleep.
Right.
And I have gotten letters from people all over the world saying they like to go to bed with me. Obviously, I'm at home with Tana because I find that so helpful. So hypnosis, meditation, it's just some practice to learn how to quiet your brain.
Yeah, meditation's been so helpful for me.
Oh, I agree with you guys, absolutely. So meditation, progressive relaxation, which is a form of hypnotic induction.
Mm-hmm.
We talk about guided imagery and
Yes.
visualization, all with a means to quieting the brain. So what works for one may not work for another, which is why it's so important to have a very individualized, targeted approach to this issue.
I love that. That's so important. When we come back, we're going to talk about sleep apnea, also restless leg, and their impact on marriages. Welcome back. We are here with Dr. Shane Creado, an Amen clinic psychiatrist. I'm so proud of him, sleep medicine specialist, and we're going to tackle sleep apnea. Now, why does a psychiatrist care? And why do I care about sleep apnea? Because we do brain SPECT imaging, and what I started seeing with SPECT scans is that people, they look like they had early Alzheimer's disease on their scan.
Interesting.
And what it really was untreated, undiagnosed, or diagnosed and untreated, very common sleep apnea, and it gives you an oxygen debt state that really murders brain cells.
I have a question. So when people are sleep deprived, Dr. Creado, do you see that can actually exacerbate or magnify underlying psychiatric issues dramatically?
Oh, definitely. Definitely. It goes to every single psychiatric disorder. It goes to PTSD, to anxiety disorders, to depression, to schizophrenia and cognitive impairments. And when we think about sleep deprivation and associated factors like sleep apnea, I chose to do sleep medicine training because really I felt our psychiatric training didn't really equip us to understand comorbid insomnia and sleep issues. And the reason I say comorbid is because in modern sleep medicine, we don't associate it as primary or secondary insomnia, for example. If the sleep issue is corrected, it improves the mood disorder and vice versa. They need to be tackled individually. So in people with PTSD, anxiety disorders, there's an increased risk of central sleep apnea, where their brain triggers the muscles to stop breathing because they're hyperventilating all the time.
So that's actually very important because we don't have much time and I want to talk about sleep apnea and restless leg. But children who have ADHD, who snore, that they actually may have sleep apnea that is the primary cause of their ADHD symptoms.
Oh,
And
yes.
missing that, these are kids that do not respond well to stimulants. And you're really doing them a huge disservice. And correct me if I'm wrong, the idea I've had in my head, when I was young, there was a lot of tonsils and adenoids that were taken out, and they basically stopped that process. And when you have large tonsils or large adenoids, what happens is you can't breathe properly. You end up with sleep apnea, and now you have learning problems, and you're on medicine for ADHD. So
You're so right. You're so right about that. I saw that in our practice with child and adolescent psychiatry. A lot of kids are put on stimulant medications because they have concentration problems, they're falling asleep, they're bouncing around, they have behavioral issues. Sleep apnea manifests very different in kids. They'll be irritable, they'll be cranky, they'll be causing trouble, they won't be able to do their homework. They're assumed to be problematic children. They put on medication for behavior issues. It's horrible. So we need to figure out if they're having sleep apnea and how to correct it. And you're right. Simple strategies. We do a sleep study in a lab, figure out if they stop breathing, treat the obstruction. If the kids have big tonsils or adenoids, those need to be out. And then you need to do a follow-up sleep study in a few weeks to figure out if the issue is resolved or not.
Yeah, that's so interesting. So we like, just, it's common sense that we think of, if you have a psychiatric issue, that it would affect your sleep, but we don't necessarily automatically think that sleep causes these other problems.
isn't that
So,
interesting?
yeah.
So what are the major symptoms of sleep apnea? When should someone suspect it?
Okay, well, sleep apnea simply means a pause of breathing while you're asleep. The most common type is obstructive sleep apnea, where airway closes off and periodically during the course of the night, you stop breathing. So obviously symptoms might be snoring, which is primarily while you're breathing in. It's caused by vibration of the palate, the soft palate and the uvula. You may have morning headaches because your brain has been deprived of oxygen, or dry mouth. You may have high blood pressure. You may feel sleepy during the day because you're sleep deprived. Drowsy driving is deadly. 6,400 fatal accidents in the US alone because of drowsy driving. Of course, if you have a thick neck, generally more than 16 inches, if you're a male, you have double the risk of developing obstructive sleep apnea, unless you're a female who's hit menopause, and then there's an equal incidence over there. So these are the important things we need to look for, and if someone meets those criteria, it's worth getting a sleep study done to make sure they don't have sleep apnea. There's a 20% concordance between sleep apnea and depression, which is huge. So we always ask people about thyroid problems and depression. How often do we ask a few questions? Like pauses in breathing. Of course, your partner will have to tell you that. Honey, I saw you stopped breathing for a few minutes last night. I was terrified. Some partners may be fine with that. In that case, be careful.
I actually helped you.
So there are some telltale signs there, and they need to be investigated further because sleep apnea can be deadly. So the way we think about sleep apnea is, how bad is it? We talk about the number of times someone stopped breathing at night. And if you stop breathing 5 to 15 times per hour, it's considered mild. 15 to 30 times per hour, it's considered moderate. And if you stop breathing more than 30 times per hour during the course of the night, it's considered severe sleep apnea. But that's very, very simplistic, because what if you're stopping breathing 10 times per hour, so-called mild sleep apnea, but those pauses are several minutes each,
Right.
or you're having severe dips in your oxygen? That's dangerous.
Yeah, that sounds crazy.
Now, I have had so many patients diagnosed with sleep apnea. They tried the CPAP for 3 nights.
They hate it.
They hate it, and they just ignore it. I did a YPO retreat where 8 YPO members, that's Young Presidents Organization members from Philadelphia, came to our California clinic. I scanned them all. And then as a group, I talked about each of their brains. And I remember this one guy, he was diagnosed 3 years ago. His brain looked awful. And he's like, well, I was going to get around to it, but I don't like it. And I just really got after him about, you're murdering brain cells every night that you're not taking care of this problem. So if someone is having trouble getting used to the treatment, what do you do?
Okay. There are many treatments. People always think, oh no, I don't want to be tested because you're going to force me to wear a CPAP. But there's many more options. The first thing is weight loss. In fact, if someone loses more than 10% of their body weight, we should retest them to look and see whether their sleep apnea still needs to be treated with CPAP.
You stopped snoring after you lost weight. Now you rarely snore.
Thank you.
Yeah, no.
Now the whole whole world knows this.
Yeah, no, thank you. You're the one who tells everybody you lost 20 pounds, and it affected your sleep, your snoring. Yeah.
Absolutely. And see, if you lose weight, you're not going to be having disrupted sleep. Your leptin is not going to be driven down. You're not going to be feeling hungry all the time. It's a positive feedback cycle over there. So weight loss is key. Then when we've done the sleep study, some people just have really bad sleep apnea on their back while they're in their supine position. Or when they've had alcohol at night, then they snore more. Or when they've had a muscle relaxing medication or Valium, benzodiazepines, then it's best to change the medication or even simply sleep on your side. That's an effective strategy for many people.
Oh, how interesting. That is so interesting. All right, we're going to have to stop because I have just, as I'm sitting here talking to you, I want to talk quickly about restless leg syndrome, but then I really want you to talk to our group about dreams. And why we dream, what it means. I just think, as two psychiatrists talk, Freud said it was the royal road to the unconscious. Is that complete nonsense? What are your thoughts? Stay with us.
We're back with Dr. Creado, and this is so interesting and so helpful. We're talking about sleep issues. And Dr. Creado, before we jump into restless leg, I really liked something you talked about in the last segment with sleep apnea and how hard it is for people to get used to their masks. But it reminds me of something. It's about taking care of yourself and loving yourself. And when I first met you, we mentioned in the last segment that you lost weight and it helped your snoring. But when I first met you and we were getting serious and engaged, and it was hard for me because you snored, and I'm like, I can't sleep. This is really affecting my sleep. It's like, do you throw the relationship away because of something, or do you figure out a way to fix it, right? So I started wearing earplugs, and you like to read at night, so I started wearing an eye mask, and I did that because I love the relationship. So why would you not figure out a way to wear a CPAP machine because you love yourself? I'm confused by that.
I would have hated to have lost you over that.
Right. I would have
Now
like
I'm,
it
I'm
seemed,
like I'm about to have a panic attack
it,
now.
it seemed, no. My point is, it would have been silly. Like it would have been silly.
We're gonna have to
And
use
you
Dr.
could lose your
Creado's
partner.
therapy techniques with us. No, all right, because we don't have a lot of time. 3 minutes on restless leg. How do you know if you have it, and what do you do about it? And then I want to talk about dreams. What's
Now,
the
restless
cliff
legs
notes?
tends to be a misnomer because people say, oh, my legs shake all the time while I'm in class, while I'm at work. I must have restless legs. No, restless leg syndrome is a very specific disorder and it's a clinical diagnosis. So if someone has a weird sensation in their legs, maybe some people describe it as pulling, burning, pain, irritation, various terms to define how they feel about it. Number one, that's worse at night or worse at rest and relieved by movement, they may have restless leg syndrome. Now, it's not just the legs, as I said, it's a misnomer. So 21 to 54% of people also report some arm movements as well. It's under a group of conditions called sleep-related movement disorders in sleep medicine, kind of like periodic movements of sleep. They might be having sleep leg cramps, or rhythmic movement disorder, or myoclonus, which are little jerks when they're falling asleep. So it's very important to understand whether in fact it is restless legs or one of those conditions or neuropathy or nerve damage. Now, if someone has restless leg syndrome, the first thing we need to do is, again, with anything we do in medicine, look for the underlying cause. Don't just throw medications at this condition. Figure out why this is happening. One of the most common causes is iron deficiency or abnormal iron metabolism.
Oh.
So I always want to make sure my patients have good iron levels, but not just iron levels, but also a storage form of iron called ferritin. And
Wow.
even if it's within normal limits, I want to see it above 75, and the normal limit, it might be at 50. That's not good enough for us because iron helps in producing dopamine. And one of the most common medication treatments for restless legs, for example, is a dopamine agonist like Mirapex or Requip, medications like that. So there is a growing body of evidence to suggest that dopamine abnormalities may result in restless leg syndrome.
That's so fascinating.
So, which is why ADD children are hyperactive, and
there is
which
a
is a
correlation
deficiency
between ADD and restless leg syndrome.
Oh, I'm so
There is a
fascinated.
strong
I always thought it was
correlation.
like magnesium, and
which
it's
is often
iron.
a deficiency of ferritin. So we often see kids who have low ferritin levels. Now, just so
that's
people
so
who've heard me
interesting.
speak before, high ferritin's not great for you because it increases heart disease and dementia, causes internal rusting. It's about what's optimal, which is, as Dr.
That's
Creado
really
saying,
interesting.
is around 80 to 100. If it gets above 300, I think you should actually get bled because
Don't go buy leeches, just go donate blood.
Yeah, that's the whole thing between us.
So I have a question. So what qualifies as restless leg? If you obviously have an occasional episode of this, does that qualify as restless leg, or does
No.
it have to be, I mean,
It could be you just traveled.
right, like you slay dragons when you get home.
I always go with my patients' goals. So if it's causing them to have disrupted sleep or not being able to fall asleep or really troubling them for more than 15, 20 minutes most nights, let's treat that. Let's figure out the underlying cause. Is it low iron? Is it caffeine, alcohol? Women who are pregnant may develop restless legs and it may subside once they've delivered the baby. Sleep deprivation can result in restless leg syndrome. Diabetes, antidepressants, anti-anxiety medications are notorious for this. Of course, the one exception may be Wellbutrin because it doesn't act on serotonin. Antihistaminics, anti-allergy medications like Benadryl, hydroxyzine can also worsen it. Antipsychotic medications can worsen or trigger restless legs. Dopamine blocking anti-nausea medications can also worsen it. So we need to figure out what's causing it. In fact, people who have obstructive sleep apnea may have the restless legs. And if the sleep apnea is corrected, the restless legs can resolve.
What about a magnesium deficit? I mean, I heard 80% of the population is low in magnesium.
Yes, magnesium is important, and some studies have shown benefit for restless legs with magnesium supplementation. So
Interesting.
if it's deficient, we should supplement.
All right. Well, we promised them, and I think this is what a lot of people are waiting on, is talking about dreams.
So interesting.
Why do we dream, and what the heck do they mean?
Yeah. Well, this is one of the reasons I got into sleep medicine is because I did my psychiatry training and I studied one of my mentors, his written books. He's a psychoanalyst who trained in Harvard, and he's written books on dream analysis. And so I worked with him processing patients' dreams. And dreams tend to occur in dream sleep or rapid eye movement sleep. If you look at the EEG on the polysomnogram, you know when someone is going to dream sleep. And in those times, people dream. But Freud once said that dreams are a combination of what you've experienced in the past, the stimuli you're experiencing while you're asleep, and anticipation of future issues as well. The hippocampi primarily create the dreamscape. The right and left hippocampi map the topography of the dream and the timescape to create the dreamscape. And I've used dream analysis frequently with my patients in processing what they're experiencing and how it maps onto their current life situation. In fact, they've done experiments on rats where they've had rats with electrodes go through mazes, and then they look at the areas that are active in the brain, and then they record the rat's sleep. And dream sleep, the same areas of the rat's brains are active. So we're really cycling through what we're experiencing every day in our dreams. For example, a lot of our patients with anxiety disorders frequently have dreams of being chased or in dangerous situations because that's what they're cycling through while they're awake. And no wonder they can't fall asleep. A lot of people suffer from middle of the night insomnia, where they're waking up in the middle of the night and cannot fall back asleep. They say, I don't know why I woke up. Well, dream sleep is more common in the later half of the night. That's when you start your dream cycles. And so they might be waking up in a panic, their heart racing, their blood pressure going up, them waking up in sweats, because you're reliving what you're experiencing every day and anticipating the next day.
So I have a question. So when I was younger, I had this sort of these weird recurring, I guess you'd call them nightmares, that someone was chasing me, which you just described, and that right before I would get caught, I would take off flying, and the flying was really hard. Initially, I couldn't fly, but then all of a sudden I'd start flying, and I was up above what was happening, and it was the coolest thing. I'd be like up above it, but it was always like this like really intense pressure, like about to be caught, and then I would fly. Do you hear a lot of people talking about flying in their dreams?
No idea.
Oh yeah, no, it was terrible. It was always like really scary.
Sounds really cool.
Yeah, well, it is in the end, but they're almost getting caught.
So what would you do with that, Shane?
But wait, do you hear a lot of people talk about flying in their dreams to get out of situations?
I do, and it's important to remember that we shouldn't go to Google or look at what what they think dreams mean, because it's really individualized.
Okay.
So I always dig in really deeper with my patients. I know what they've been going through life. I know how it maps onto what they're currently experiencing. So in cases where people tend to escape from a dangerous situation, not necessarily flying, but escaping from a dangerous situation, it tends to be metaphors. The subconscious mind speaks to us through metaphors and brings to our awareness what we need to be aware of, what we usually suppress with our conscious minds. So in this case, I would think it maps onto escapism, really. As kids, you may create these imaginary friends. Kids who've been traumatized may actually experience derealization or depersonalization, where they feel that they're alternate realities and things like that. So in the dreamscape, it might represent a form of escapism where you're getting out of that scary situation by having powers you wouldn't otherwise have in the real world.
Interesting.
Let me give you an example of a veteran I treated a few years ago who had severe PTSD, and his symptoms were all really well controlled with our treatment protocol. But one day he came to me and he said, "Oh, my PTSD has come back." I said, "What happened?" He said, "Well, I had a terrible nightmare. I dreamt I was back in Vietnam." I said, "What happened?" He said, "Well, I dreamt that I was in Vietnam. I had my gun ready. There were 3 Viet Cong approaching behind a wall, and I was ready for them. And then I looked down and my gun is missing."
Oh,
I said, what did you do? He said, well, I panicked in my dream, but I waited for the first guy to come around. I tackled him and, dealt with the other two. So he saved himself in the dream. And through understanding where it happened just before he went to sleep, it turned out that he had forgotten to take his nighttime medicine. Now, with the medications he was on, they would last in his body for a few days. So it wasn't like the symptoms would come roaring back. But the metaphor his subconscious used was, in Vietnam, his weapon was the gun. Now, his weapon is his medications to fight against these symptoms. He was missing his medication or his weapon in Vietnam, but in spite of that, he could overcome his symptoms. He could overcome the situation and survive. So it's really fascinating what our dreams can tell us about our own resilience.
oh, it's so interesting.
And I love the idea that you talked about dreams often will speak to us in metaphors. And if you can understand the metaphor, Louis Gottschalk, who was the chairman of the department at UC Irvine and was my neighbor for a long time, so I loved his work. He was really a pioneer. He wrote a book about dreams, and he said to understand dreams, you really need to understand three things. So that each dream tends to contain a wish or a fear, something from the past, and a current event that triggers it. Does that fit with your experience?
Yes, that's what Carl Jung would speak about with dream fulfillment, fears that have not been really faced, or accomplishments not yet achieved, or goals that you're reaching toward. So it really maps well onto what Carl Jung spoke about and Freud spoke about, and what we know from modern neurobiology with the areas of the brain responsible for dreams.
Well, that would certainly fit with what I like,
With
the
your-
almost being caught and then getting away from the
So this
situation.
is what, so our niece, who we talk about on this show, both our nieces were taken by Child Protective Services to foster care because their mom and dad, were not right.
They just had there was
And
an
so
issue.
we really helped her mom get together. She got her kids back a year ago, Mother's Day, and but my 13-year-old niece, she had this recurrent dream of being in the red truck, and it always happened. She'd always wake up at 1:10 in the morning, and she was afraid. And so what I have my patients do whenever they have a recurrent dream is before they go to bed, finish it. So imagine it, but then put an ending on it
I like that.
that is safe and really go through it. And what is really cool is it tends to then stop because they'll have a dream or two where they actually finish it in a more positive way, and then it'll stop.
I don't know. I mean, I don't have your education in this or experience, and so I would love to hear your feedback. And as somebody who just was doing what I knew how to do sort of intuitively to deal with stuff, something that helped me, one, was meditation and visualization. Really helped with just visualizing, safety and whatever, going through my day and doing that on a daily basis. But also, oddly enough, things like practicing karate. So doing some things that for me felt empowering.
Yes.
I don't know why, but those dreams went away. So
Because you were finishing them in a more positive way.
I felt empowered. And I don't know if that had any connection, but it felt to me like I feel more empowered in my daily life, and somehow that went away. I didn't start karate for that reason. I just noticed that it tended to go away.
Well, and what Shane's talking about is dreams as metaphors. So you have developed other metaphors that are healthier. Shane, this
I
was
agree.
just great.
So,
we have
but
to
is that
stop, but
what
we
you
have to
do?
do this again.
Yeah.
But you're going to come out and we're going to film a whole course. We should
Yes.
make dreams part of it because
I
I
like
think
it, yeah.
people are just so interested in it. Dr. Shane Creado, he is in our Chicago clinic until the fall when he's going to move to New York. If you have a sleep problem, you would actually set up a phone
This is so
consult
interesting.
with Dr. Creado. He's so helpful. I use him for many of my patients, and I am just so grateful you're part of our Amen Clinics family.
Thank you
I'm
so
grateful
much.
to
So
be with you
fascinating.
guys.
Yes, thank you.
Thank you so much. It's been a pleasure seeing you and talking to you guys today.
Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. Go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of the Brain Warriors Way and the Brain Warriors Way cookbook we give away every month.